Hi there, welcome to part two of video series on primary health care, okay, the foundation. And if you have not watched part one, just go ahead to look for the link in the description box below. Also, a book will be coming out on this. Also, look for the link in the description box below. So, in today's video, we are going to be looking at community-centered healthcare planning. Okay, we're going to be looking at the principles and practice of community-centered healthcare planning, emphasizing the importance of collaboration, inclusivity, and participatory methods in achieving equitable and sustainable health outcomes. Okay, so first of all, we have to understand the community dynamics. Okay, when it comes to planning for primary healthcare services in the community, you have to understand about what's going on in your community, looking at their demographics. Okay, you have to understand their age distribution, the mother, the fathers, gender ratios, population density, how large is the community. A community might just need one primary healthcare center, another community might need two or three. So you have to know the population density and of course the migration patterns, which all influence health needs. You also have to look at socioeconomic conditions, looking at the income levels, the education levels. Is there university in that place, for example? How many people have tertiary education, employment status, jobs there, determine access to health care services and affordability. Also look at their cultural norms, of course. There are different cultural beliefs in different communities, and this influence their health behavior, such as their dietary habits. Some people don't eat fish, some people do eat fish, some people don't eat meat, some people, they have that. And also their health seeking behavior is also very important. Now, there are frameworks to primary health care planning. Okay, we have the precede proceed model, we have the social determinants of health, the SDH, and we have the logic model. Okay, so these frameworks have been explained in detail in my book that is coming up on primary health care, foundations of primary health care. So you should look for the link in the description box below. The precede proceed framework has to do with identifying community needs and then addressing the factors that influence health behaviors. Then we have the social determinants of health. This framework looks at the influence of socio-economic and environmental factors. Remember, health is not just the absence of diseases. Okay, it involves all that factors, social, environmental factors. So this particular framework looks at the influence of these factors on health outcomes. So we have the logic model, which provides a visual representation of the relationship between resources, activities, outputs, outcomes, and impacts, and just looks at how they are all connected. So what are the participatory approaches in healthcare design? Remember that primary healthcare cannot function properly without the participation of the community itself. So number one is community engagement. Community members actively contribute ideas, okay, share concerns, and also suggest solutions in the healthcare design. Also, there is shared decision making, okay, so decision making power is distributed among the stakeholders. Who are the stakeholders? We'll get to know more about them as we go on, but they include community members, healthcare providers like you and I, for those who are watching, and we have policymakers as well. Then we also have capacity building. Okay, participatory approaches often involve training and empowering members of the community to take active care, play an active role in healthcare planning. So what are the benefits of this participatory approaches? Number one, there's increased relevance. Okay, programs are more likely to address actual needs and priorities, increasing their relevance and success. Okay. Number two is to enhance the trust between the healthcare providers and the community members, and of course other members of these other stakeholders as well. Okay, the third one is sustainability. Okay, programs designed with community input tend to last last longer, and are also culturally appropriate. Then empowerment is the fourth one, which involves active involvement in healthcare design, empowers the individuals and people of the community to take charge of their health, to take charge. That's what health promotion is about. And of course, that's what healthcare is also, primary healthcare is also about. So let's look at examples of participatory approaches. Number one, we have participatory rural appraisal, the PRA, which involves committee members in assessing their health needs and identifying solutions. Okay, we go around, find out, okay, what's their problem, and come up with solutions to address that problem. We have community health committees, okay, giving each person is responsible for achieving so and so. So they consist of local representatives who work with health professionals to actually design and oversee the health programs. Then we have citizen science initiative where community members collect data on local health issues such as health, air quality or disease prevalence. Like we have the measles outbreak that happened in some parts of the country, even polio, in a bit to eradicate polio in Nigeria. Have people that report this outbreak. Then we have participatory action research, which combines research with action, not just researching, but combining it with action, which involves community members as co-researchers in studying these health problems and implementing solutions. But however, this participatory approach is faced with challenges. Number one is time intensive. Okay, it requires a significant amount of time for building trust and gathering input and reaching consensus. There's some power dynamics. Okay, ensuring that equitable participation can be difficult, especially in communities where existing power imbalances. We have the egos dragging, people dragging for power, who do this and who do that, and of course there's resource limitations as well. Like I said before in my other video, inadequate funding is one of the problems that and challenges that is faced in primary giving proper quality primary healthcare services in establishing it in the community. So implementing participatory approaches often requires additional resources such as training. Of course, training is not free. Okay, you need to pay the trainers that are going to train. We have facilitation and of course ongoing support. Then we have last one is managing expectations. Okay, so clear communication is very, very, very important to avoid unrealistic expectations. That's why I say don't go and say what you cannot provide. Okay, you have to make sure that you are able to provide something before you go and say it. Okay, so you don't give the people unrealistic expectations about the program that is going to be achieved. Then we have reward applications. Once again, we are looking at Rwanda. We looked at Rwanda in part one, and we are looking at Rwanda and Brazil in part two as well. So in Rwanda, use of community health workers to deliver essential services, which reduced maternal and child mortality rates, which is very, very brilliant. And of course, the family health strategy that Brazil used to engage local families in health planning is so good. And many other countries have been able to successfully implement community-centered healthcare planning approaches. Why not Nigeria? So it's very, very important. So what are the key takeaways in today's video? We know that community-centered healthcare planning emphasizes collaboration between health systems and communities where we serve. We have inclusivity. This approach ensures that healthcare services are equitable, culturally appropriate, and relevant to the community. We have participation, engaging community members through participatory methods that empowers them to voice out their health concerns and of course to contribute to the decision-making process. Remember that we cannot work without the community members. So what are the next steps? Number one is to conduct a thorough assessment of the community's health needs and dynamics first before you carry any health program. You do a needs assessment. Number two, you plan. Okay, you develop a comprehensive health care plan that addresses, identifies the needs and priorities, and of course next thing after planning is to implement that plan, and that is through these participatory methods involving committee members in the process. And the fourth one is to evaluate, where you continuously monitor and evaluate if the program you have provided, whether it's effective, whether it's working, and make adjustments where it isn't. Okay, so that's all for today's video. Ensure that you watch the next one, and if you have any questions, leave it in the comment section below, and speak the book that is coming out on primary healthcare. I'll also put the link in the description box below. Thank you, and see you in my next one.